Imagine waking up with a headache that feels different. Not just stronger, but persistent. It doesn't go away with rest. It doesn't respond the way it usually does. First, it's easy to ignore. Stress, fatigue, maybe dehydration. But then something else happens. You forget simple things. Words don't come out clearly. Your balance feels slightly off. Small changes, subtle shifts, until they're not so subtle anymore. This is how a brain tumor can begin. Not always suddenly, but gradually, quietly, and often unnoticed in its earliest stages. In this video, we'll explore what a brain tumor really is, what's happening inside the brain, the different types, the warning signs, treatment options, and how individuals and families navigate one of the most complex neurological conditions. What is a brain tumor? Let's start with something important. A brain tumor is an abnormal growth of cells within the brain or surrounding tissues. Under normal conditions, the body tightly controls how cells grow and divide. Old or damaged cells die and new ones replace them. But in a tumor, this process breaks down. Cells begin to multiply uncontrollably. They don't stop when they should, and they don't die when they're supposed to. As these abnormal cells accumulate, they form a mass. That mass can press against surrounding brain tissue, disrupt normal brain signals, interfere with blood flow and fluid balance. It's also important to understand, not all brain tumors are cancerous. Some are benign, meaning they grow slowly and don't spread. Others are malignant, meaning they grow more aggressively and can invade nearby tissue. But even benign tumors can be dangerous, because the brain exists within a fixed space. There is no room for expansion. So any additional growth, even small, can create significant pressure. Pathophysiology. What happens inside the brain? So what's actually happening inside the brain? The brain is enclosed within the skull, a rigid structure that cannot expand. When a tumor develops, it occupies space. It compresses nearby tissue. It disrupts normal brain function. This leads to a condition known as increased intracranial pressure. As pressure builds, blood flow may be reduced. Oxygen delivery becomes less efficient. Brain cells begin to function abnormally, in addition to pressure. Tumors can also directly interfere with neural pathways. This is why symptoms vary depending on location. For example, a tumor in the frontal lobe may affect behavior and decision-making. A tumor in the temporal lobe may affect memory and language. A tumor in the occipital lobe may affect vision. A tumor in the cerebellum may affect balance and coordination. As the tumor grows, symptoms often become more noticeable. Brain function becomes increasingly disrupted. In severe cases, the brain may shift within the skull, a life-threatening condition known as herniation. Types of brain tumors. Brain tumors are classified based on origin and behavior. Primary brain tumors. These originate in the brain itself. They develop from brain cells or nearby structures. Common types include gliomas, arising from supporting brain cells, meningiomas, from protective membranes around the brain, pituitary tumors, affecting hormone regulation, secondary, metastatic, brain tumors. These begin in another part of the body and spread to the brain. They are actually more common than primary tumors. Common sources include lung cancer, breast cancer, melanoma. Benign versus malignant. Benign tumors grow slowly and usually don't spread. Malignant tumors grow rapidly and can invade surrounding tissue. However, both can cause serious problems depending on their size and location. Signs and symptoms. Symptoms depend on the tumor's size, location, and growth rate, but there are common warning signs. Early symptoms. Persistent headaches, often worse in the morning. Nausea or vomiting. Fatigue. Subtle cognitive changes. Neurological symptoms. Seizures. Weakness or numbness in one side of the body. difficulty speaking or understanding language, vision problems, blurred or double vision, loss of balance or coordination, cognitive and behavioral changes, memory problems, personality changes, difficulty concentrating. Unlike sudden conditions like stroke, brain tumor symptoms often develop gradually, but over time, they become harder to ignore. Diagnosis. Diagnosing a brain tumor requires imaging and evaluation. Common methods include MRI scan, most detailed, CT scan, biopsy, to determine tumor type. These tests help doctors understand location, size, type of tumor. This information is critical for planning treatment. Treatment, medicinal and surgical. Treatment depends on multiple factors: type of tumor, location, size, patient's overall health. Surgery. Often the first step, removes as much of the tumor as possible, reduces pressure on the brain. Radiation therapy. Uses high-energy beams to destroy tumor cells, often used after surgery. Chemotherapy. Uses drugs to target and kill tumor cells. Targeted therapy. Focuses on specific molecular features of tumors. More precise treatment approach. Treatment non-medicinal. Recovery doesn't end with treatment. Supportive care is essential. This may include physical therapy, speech therapy, cognitive rehabilitation. These therapies help restore function, improve independence, support long-term recovery. Prevention, what can we do? Brain tumors are not always preventable, but some general measures may help reduce risk. Avoid unnecessary radiation exposure. Maintain overall health. Seek medical attention for persistent symptoms. Early detection is key. How families can help. A brain tumor affects more than just the individual. It affects families. Support can include helping with medical decisions, providing emotional support, assisting with daily tasks. Patience is important, because recovery can take time, and changes in behavior or ability can be difficult to adjust to. Conclusion. A brain tumor may begin quietly, almost unnoticed, but its effects can be profound. Understanding the condition is the first step, because awareness leads to earlier detection, and earlier detection can improve outcomes. If you found this helpful, share it, because the right information at the right time can change everything.